Hello, everyone. My name is Sam Harvey. I'm currently a student in the Diploma in Mountain Medicine program at UNM, and I will be doing a presentation for you on non-freezing cold injury. So what is a non-freezing cold injury? It's commonly referred to as trench foot, though it is more likely to affect the extremities, such as the arms and the legs. It can affect any part of the body, but it's more likely to affect extremities. And basically, it results from an, a prolonged exposure to cold temperatures over a long period of time. So, say you're working in a meat packing facility, or as a fisherman on the sea, or if you're a soldier that's doing exercises or fighting in a battle in a cold environment. Those are populations that we're more expecting to see non-freezing cold injuries. And these are injuries that are not frozen. So we're not talking about frostbite or frost nip here. This is non-frozen injuries. So they're warmer than frozen temperatures that they occur, but it's still cold enough for injuries to occur. But before we get into the meat and potatoes of what non-freezing cold injury is, um, how it happens, how we can treat it, how we can prevent it, I think it's important to discuss the history of non-freezing cold injury, where it was discovered, places that we've seen it in the past that can kind of give us an idea of things in the future to look out for, places that could be more high risk for this kind of this problem. So the first real documentation um, of non-freezing cold injury or trench foot was actually described by a French doctor who was part of the French army who went into Russia to try and invade Russia. They ended up not doing so well, as I'm sure you know. Anyone that tries to invade Russia generally doesn't do very well due to the really harsh weather conditions. But basically, what happened is Napoleon went in to try and invade Russia. It didn't work, and he had to retreat during the really harsh Russian winters. And so this French army surgeon, Dr. Dominique Jean Leray, started documenting these findings of trench foot in the soldiers. So he started noticing that soldiers who had been keeping their boots on, marching through these cold, wet conditions, started to experience symptoms that are consistent with what we now know as non-freezing cold injury, or were later called trench foot. So this was the first real time that it was well documented. I'm sure it happened many times before then, but this is the first serious documentation of this condition being, done in a consistent manner. So fast forward a few years, and we get to the First World War, where we start to see many more cases of these medical conditions similar to what Dr. Jean Leray saw during the French retreat from Russia with Napoleon. So we're starting to see soldiers fighting in trenches that are usually only a few feet above sea level. So they're getting wet, and this is in the middle of Europe. So it is cold, it's miserable. If you've ever been to Europe, you'll understand that it's rainy, it's cold, it's miserable. And so we have really good documentation from the British forces that were in Europe at the time, as they were the ones that were most affected by this trench foot, and with their method of trench warfare, as they were not as well equipped to keep their soldiers, dry and warm as the German soldiers were that they were fighting against. The German soldiers actually spent a lot of time making their trenches more hospitable because they thought that they were going to be in the trenches for a long time. So they ended up making them a lot more hospitable, better for living in for long periods of time. Whereas the British military command thought that the trenches would be, you would stay in them for short periods of time and then move forward. And that ended up not being the case. It was a lot of standstills, staying in these trenches for long periods of time. It would get very cold, very wet, very muddy. And so those are perfect conditions for non-freezing cold injury to occur. And so that's when we started seeing many, many, many cases of trench foot start to appear. And so it was so severe that almost 75,000 British soldiers were thought to have died from complications of trench foot. So either they started to get trench foot and then died as a result of it. They got infections. They had to have amputations, and they got infections from the surgeries of the amputations. Overall, it was just not great. And so we have a lot of documentation of medical personnel in the British Armed Forces documenting these horrible things that are happening to these soldiers, and kind of seeing what's going on with these soldiers here. So you might be thinking, oh, it's well and dandy. Napoleon's soldiers were suffering from trench foot, dying from trench foot. We have British soldiers, German soldiers, American soldiers, French soldiers in the First World War. They're all suffering from trench foot. But these are things that happened over 100 years ago, 200 years ago. So why do we care about trench foot? Why do we care about non-freezing cold injury in 2020? And that's because it is not limited. It's not a problem that's limited to history. We've had some very recent, widespread recorded cases of trench foot. So the Falklands conflict, again, the British Army just loves to go to wet, cold places. So I guess that's what from wet and cold you come, from wet and cold you must invade, I guess. But so we see the Falklands conflict in 1982. There's many, many cases of British soldiers in this conflict who were diagnosed with non-freezing cold injuries or trench foot, having, stood around, done maneuvers or whatever in these cold, wet conditions. But more recently, we've had the Glastonbury Festival, again in the UK, where it is wet and cold. So during the Glastonbury Festival, there was a lot of people that were wearing Wellington boots, which are rubber rain boots. And so they were walking around this festival during these cold, wet, rainy conditions. And these festivals are several days. So these people were just walking around with these boots because the rain didn't stop for several days. So these people were not cleaning their feet. They were not keeping their feet dry. And at the end of the day, there was a large number of people who attended the Glastonbury Festival in 2007 who were ultimately diagnosed with non-freezing cold injury because they had subjected themselves to these cold, wet conditions and not made any attempts to prevent any injuries from occurring, because they hadn't expected something like this to occur at a music festival. And also, we can also see this happening in homeless patients. So patients that may not necessarily have the facilities to keep themselves clean, to keep their socks clean, to dry out their footwear, to dry out their socks, their clothes, especially if they haven't got a place to stay as well, if they're sleeping on park benches or under bridges. They are extremely at risk for non-freezing cold injury. Just as in the attached case study that I've distributed, there was a homeless guy who was not able to keep his socks clean, keep his clothes clean, keep his shoes dry, and he ended up with a pretty significant, severe case of trench foot, where he had to actually have some surgical debridement done and some tissue necrosis. So that was in 1997. So it's not something that is limited to, poorly equipped soldiers in the First World War, the Napoleonic Wars. These are things that happened, within my lifetime. So what happens when you subject body parts to cold but not freezing temperatures for a long period of time? And these don't necessarily have to be like cold temperatures like 34, 40 degrees. These injuries have been documented to occur at temperatures up to 60 degrees Fahrenheit, which is not that cold. So if you're in these environments for long periods of time, it can happen at temperatures higher than you would expect. But basically, the way that I understand it, your body can get confused about how it responds to cold, especially in the extremities. So your body can be in a cold environment and say, hey, I'm cold, I need more blood in my vital organs. So it can start to vasoconstrict, to try and, in your extremities, to try and push blood into your vital organs, in your trunk and your thorax, your abdomen, which makes your extremities a lot colder. And at the same time, your body can get confused with the cold and say, hey, my extremities are cold, and start to vasodilate. So you get this paradoxical vasoconstriction, vasodilation. Your body doesn't really know what to do, especially when it's cold, but it's not freezing. So you can get this variable response of vasoconstriction and vasodilation, which can cause ischemia and subsequent tissue damage, because your body's not sure how it wants to perfuse itself, whether it wants to prioritize its centrally with its vital organs, or it wants to perfuse the extremities because the extremities are not getting blood flow. So it doesn't really know what it's doing, and it can end up in hypoperfusion and tissue injury, which is what we'll be seeing. So in the early stages of non-freezing cold injury, we'll start to see the affected body parts, usually the feet, start to swell up. We'll see blisters form, sores form, your feet will get painful. The skin here, especially if it's wet, will start to look like your feet have been in the bathtub for too long. And so the skin will become very delicate. You can get numbness, tingling, and you can start to see this kind of characteristic, soggy foot appearance. So it looks like somebody's left their feet in the bathtub for like 6 hours. And ineffectively you have, but it's been in a cold bathtub. So your body's not really perfusing your feet well, because it's not sure whether it wants to vasodilate, give you more blood, or prioritize the blood supply to your central body. So it just ends up, not being great for your extremities usually. So at this point, it's pretty reversible, pretty treatable. Studies have shown that people with the early stages of non-freezing cold injury usually have a pretty good recovery. If it's identified early enough on. There may be some lasting, paresthesia, some hypersensitivity to changes in temperature, but that usually goes away. So then from an early stage, we move on to our later stages of non-freezing cold injury, where that delicate skin starts to, those blisters, the delicate skin, the sores that start to appear start to get infected. The skin can start to slough off. It's really not a great place to be. And this is where things start to get more dangerous. So you can start to get infections. Your ischemia can get worse. Your skin can start to die. And it's overall not a great place to be in. At this point, instead of doing just a passive rewarming, at this point we'd start to more consider antibiotic therapy, possibly surgery at this point. And at this point, it can start to move more towards a life threat, limb threat. And at this point, your patients are also going to be less mobile. So in a mountain rescue environment, we're really going to be concerned about is this person going to be able to walk out? Are we going to have to move them out on a litter? Are we going to have to evacuate them using a helicopter, things like that? Because these people are not going to have a great time walking. They're going to be in a lot of pain. So here we have some pictures of the late stages of non-freezing cold injury. And these are the things that we are very concerned about. So we have significant tissue ischemia. We can have tissue necrosis. We can have gangrene. You can have damage to your nerves from exposure to the cold temperatures for such a long time. And with that, we can get infections from fungus, infections from bacteria. This is the patients that we are the most concerned about, because these people are not going to be ambulatory for any appreciable distance. So if somebody's out in the woods, backpacking for several weeks at a time, and they've got a non-freezing cold injury to this degree, they're not going to be able to ambulate effectively. So these are people that you're going to have to take into consideration how you're going to transport them. And these people are also going to be the most likely to be suffering from other complications. So sepsis, gangrene, these are all things that could kill your patient as well. And it's likely going to have to result in either very aggressive antibiotic therapy, probably surgery, and a hospital stay. So these people, you're not going to be able to just, warm their feet back up, tell them, change your socks or whatever. These people are going to need to go to the hospital. So how is non-freezing cold injury treated? And the best answer is the best treatment for non-freezing cold injury is prevention. And I know that stands true for most things. Prevention is the best medicine, the most effective medicine. If you can stop something from happening before it happens, then you have a much better chance of being successful. So we have a good example of how effective prevention can be. So the British military during the First World War started to recognize that, 75,000 of its soldiers were dying from their feet being subjected to cold, wet environments for long periods of time. So they started to implement prevention programs. They started introducing things to trenches called duck boards, which are wooden walkways along the bottoms of the trenches to prevent the soldiers from, having to walk through cold mud. They also started implementing buddy check systems. So if you were paired with a buddy that you had to prompt to check their feet and change their socks at least twice a day. So soldiers were issued 3 pairs of socks and told to keep 2 pairs of socks dry at all times. And then they were also instructed to change their socks at least twice a day. And so with this buddy system, where you and your partner would have to check each other's feet out to note early signs of trench foot occurring, ended up saving reducing the amount of trench foot that was being reported in the soldiers by a great number. So it was a huge amount of soldiers that were prevented from getting these really nasty life-ending infections after after they started putting in these preventative measures. So yeah, the most important thing you can do is prevention. So if you're going out on a long mountain expedition, you're going to go on a camping trip, you're working in a cold environment, if you're going to be on a fishing boat or whatever, if you're going to go be a soldier in a cold environment, you need to prevent yourself from getting these non-freezing cold injuries. And you need to make sure that you stay dry and clean. So some of the recommendations that I read about were you need to make sure that your socks are clean. You need to not go to bed wearing dirty socks. You need to make a conscious effort to change your socks, especially if you're going to be in a cold, wet environment, multiple times a day. Really make an effort to make sure your socks are dry before you're putting them on. Maintaining your footwear. If you're wearing waterproof footwear, it's important for you to make sure that if they are waterproof, they're staying waterproof so you can protect your feet. Things like that. And I think it's not a bad idea to perhaps implement a buddy system if you are going on a long expedition or you're going to be spending a long time in a cold, wet environment or just a cold environment, to check each other for signs of non-freezing cold injury. Because you may neglect I know I personally sometimes neglect to check myself for things. So if you have a partner that forces you to say, hey, you got to check your feet out, dude, and then you remind them, hey, dude, you got to check your feet out, you're more likely to prevent non-freezing cold injury from ever occurring, which is a lot easier to do than to treat non-freezing cold injury once it occurs. So you've gone and blatantly disregarded the last slide and all of the advice I gave you on prevention of your trench foot. You went and you stood in a cold pond for 2 weeks in a row with non-waterproof boots. You went to sleep with wet, soggy, dirty socks. You didn't change your socks ever, and now you have trench foot. So what can you do to fix it, to treat it, to manage it now that it has happened and you can't? It's no longer prevention. We're playing catch up. But one of the most important things you can do is prevent it from happening further. So if you're starting to notice yourself have trench foot and you're away from a place where you can get treatment for it, prevent it from getting worse. So if you're not changing your socks, if you're not keeping your feet warm and dry, then start to do those things. But if you're starting to get more severe, significant trench foot, our treatment is slow rewarming using warm air. So for some injuries, they may do rewarming using lukewarm water or whatever. But for trench foot, the room air is usually the best way to rewarm an injured extremity, because we don't want to damage any of the vasculature with rapid changes in temperature. And it's also excruciatingly painful to rapidly change temperatures in a patient that has trench foot. So we want to focus on slow changes in temperature, rewarming up the extremity from cold. And we want to keep this area clean, especially if there's sores, blisters, the skin has sloughed off and you've no longer got that protective barrier on your foot. You want to make sure that that area is clean. We want to prevent infection. But if we've got more significant, progressions of trench foot where the skin is sloughed off, we've started to see infections set in, whether it be fungus or bacteria. The skin's sloughed off, we've got sores, blisters that are starting to get angry and infected. Then we'll start implementing, antibiotics and possibly surgery, especially if it progresses to the fact where there's gangrene, necrosis, just big areas of dead tissue along the feet. So yeah, and for any degree of severity for trench foot, it's generally advisable to try and keep your patient's pain managed. And so that can be usually accomplished using NSAIDs or Tylenol. With NSAIDs, you'll get reduction in the inflammation that can usually occur with trench foot. Tylenol will help inhibit the prostaglandins. The NSAIDs will help inhibit the prostaglandins and help with the pain. Tylenol is not going to be as helpful with the inflammation, but if it's all you have, it's all you have. With more severe cases, you can think about using opioid analgesia, possibly ketamine for analgesia, but you're going to get a lot of benefit from reducing the inflammation and the prostaglandins through NSAIDs or Tylenol.